The information and opinions expressed on Dr. Radio are intended to address the specific questions asked or situations described on the program and are not designed to constitute advice or recommendations as to any disease, ailment, or physical condition. You should not act or rely upon any information contained in this broadcast without seeking the advice of your personal physician. If you have any questions about the information or opinions expressed during this broadcast, please contact your doctor. Thanks for listening to Dr. Radio.
Top doctors, leading research, cutting-edge diagnosis, powered by the NYU Langone Medical Center. This is Dr. Radio.
This is Sirius XM Dr. Radio.
Direct from the NYU Langone Medical Center, here is Dr. Nisa Goldberg.
Welcome to Beyond the Heart. Coming up in today's show, an ENT doctor joins us to talk about stopping sinus and ear infections sooner. We'll talk about urinary issues that affect women, why you describe your pain could greatly impact your treatment for that pain. But first, the latest on treating and living with heart failure. Joining me by phone to discuss heart failure will be Buba DM. And Buba is a heart failure patient. And joining us soon will be Dr. Michael Gewirtz. Dr. Gewirtz is a medical director of the Heart Transplant and Mechanical Circulatory Support Program at the Brigham and Women's Hospital and professor of medicine at Harvard Medical School. He's also Buba's doctor and has been helping Buba navigate his journey of managing heart failure. Welcome, Buba.
Thank you. Welcome. Good to be here.
So, Buba, can you tell us about what symptoms you were having before you were diagnosed?
Yes. So I was first diagnosed in 2012. The symptoms I had were mostly a tight chest pain. I also had some cough. And then slowly over time, I was getting more and more out of breath, even from talking.
Wow. So how did you learn you had heart failure?
I had about maybe 3 weeks of something that looked like flu symptoms. So after treating the flu, I still had the symptoms. So one weekend, I decided, okay, let me go to the emergency room. I thought it was something benign, but they took a while to come back from with the X-ray result. And when they came to me, they told me, oh yeah, you have a very big heart, which I didn't know what meant. So it turns out that I had what they call dilated cardiomyopathy.
I see.
Yeah.
And that means an enlarged heart.
Yeah, so that means an enlarged heart. And at the time, we didn't know what was the source of what caused it.
Right.
So we assumed it was a flu or something that happened along the way. But fast forward to 2016, we did an MRI in California, and we turned out that I was actually born with it. And it was a congenital condition known as the left ventricular non-compaction.
Oh.
So my heart muscle actually never really formed since birth, and then with time they got bigger and bigger, so that the heart became dilated. Yes.
And how did you come to be treated by Dr. Gewirtz?
So my story is a bit unique, and it's also long. So I'll probably start by where it started.
Yes.
I'm from Mali and Senegal, so that's on the west coast of Africa. But I studied in South Africa, so and that's where I was working when I was diagnosed in 2012.
Right.
I was 26 at the time.
Wow.
So I was working there, and then I studied and I started working there, and then 2012 we got the condition stable up to the point that I moved back home to Senegal. With my family. I just got married in 2014.
Wow.
And I also became a father the same year. So everything looks fine, and we managed the symptoms until 2016 when I had started my business in energy management. And then doing that business, I was selected to be part of a program called Young African Leadership Initiative, which was a fellowship organized by President Obama at the time.
Right.
So the plan was to go to California at UC Davis for 6 weeks and then come to Boston for another 6 weeks and work with General Electric. But the same weekend I arrived, the symptoms started to come back. And then this time I was even worse than before. But I remember the signs because I had been through it.
Sure.
Yeah. So then they took me to ER, and that's when we did more tests and found out that it was congenital. But the symptom, the treatment wasn't taking. So after about a month, we did the fake test, and then we did another right heart catheterization. So they went all the way inside my heart, and my heart was working at 50%. My ejection fraction was very low, was 11. Normally that should be about 55 or
sure.
up to 60. Yeah. So
yes.
Then it turns out that I needed a heart transplant, and this was all the way in California. But in the meantime, at the Sutter Health Medical Center in Sacramento. So at the time they decided, okay, we need a heart transplant, but in the meantime, you will need a left ventricular assist device.
Right.
Essentially a mechanical pump inside my heart. But then this was all the way in California, which meant that me and my wife and our family had to move all the way there. But my wife is from Boston. She was born and raised in Boston, so her family was still in Boston. So
I see.
Yeah, that's how we decided to come to Boston, and I was transferred to the Brigham team, and then that's how I came to meet Dr. Gibbets and his awesome team.
Yeah, he'll be joining us in a little bit. He's a busy doctor, so we're giving the time so you can tell us what happened and how did your treatment, what happened when you got to the Brigham and Women's Hospital?
So when I came to the Brigham at the time, I had already had so when they transferred me to California, I had an mobile intravenous millineuron pump, so I was stabilized before I came, and I had already put in an AICD, so they confirmed the same diagnosis in California.
Yes.
So, but they had to do their evaluation and then put me on the transplant list.
Uh-huh.
The first thing they did is to put me on the transplant list, and we started planning. This was around September 2016, so we started planning for the HeartMate 3 LVAD implant, and we planned for it in January 2017. So that happened. That's when they put the pump inside my heart, which is helping my heart beat.
That's right. So for people to understand, that's a mechanical assist device that helps the heart pump. It essentially pumps the blood so that people who have heart failure have a bridge to having a heart transplant.
Yes, and in some cases also for those that don't qualify for the heart.
That's right, and then they're on it long term.
Yeah. So this pump essentially, save my heart and then allow me to be stable and then go back to life. I started working after that. I started exercising. I even do martial art.
Wow.
And now I'm doing full-time work. And then I think about a year after that, we got pregnant, and it turns out we were pregnant with twins.
Wow.
And then we had already have our boy, who was 3 at the time. So now we have him is Burak is 5, and we have twin boys that are 15 months.
Congratulations.
Yeah. So
it's a lot of work.
A lot of work, yeah. We call them LVAD babies. So.
LVAD babies. And you're working in Boston?
Yeah, I work in Boston now.
In energy?
Yeah, so I work in energy. I support energy efficiency programs. We work with a nonprofit company.
That's great. And are you on medicine as well?
Yeah, so I'm on actually a lot of medicine, but
I know.
Yeah, so I'm on heart medicines, essentially to control blood pressure. I'm also on the main one I'm on right now. It's also the anticoagulant because the blood thinner so that we have less risk of blood clot.
That's right.
So Coumadin, that's the one I'm on. Warfarin, sorry.
That's the one that we usually put people on with the LVADs.
So it's a weekly management. So we also want to make sure that there's less risk for stroke and other stuff like that.
Right.
So a lot of precautions. But besides, the usual aspirin and then I also take multivitamins. I started taking melatonin to help me sleep because there were times I would struggle with sleeping.
Sure.
And recently, at the time also, I guess the big part of the therapy for me, physically I've been really well. I've been stable, be able to keep up with the kids and exercise and stuff. But my challenge has been mostly mental. Because I had to let go of my, business back home, and it was not my plan to be in the U.S., at least not in this time. And, we came at a time where it was the most inviting time for folks like myself. So the atmosphere wasn't a welcoming one. So mentally there was a lot of challenge and cultural adaptation too. So the big help for me was a therapist. So I've been having talk therapy, and recently I also added the psycho. I started taking some antidepressant.
I think you really bring up an important thing, Buba, is that oftentimes with people who have different forms of heart disease, taking care of their mental health is as important as taking care of their physical health.
Definitely, yeah.
And I wanted to talk to you. You're on the transplant list, right?
Yes, I am.
And so what do you want others to know about heart failure and being an organ donor?
So it's for me, I think I'm also a scientist. So I think I will always encourage that. I was already organ donor before I was on the list. But what I want to say is, even with the mechanical device and all the therapies we do, it's way more than saving a life. It's about, advancing humanity at large, I guess, if I want to be philosophical. But we will be, you're not only helping somebody live life, you're helping somebody be productive. The big thing for me was to be productive to society, and I'm able to help other people around me, influence others, and then also, being there for my kids who hopefully will be also very useful to society. So that's the way I'm looking at it. The big factor is productivity.
That's right.
And being there with our family and friends, and love and productivity. Yeah.
I think those are really important. And I'm going to open up the phones for our listeners to ask some questions of you. There are many people out there who have a history of heart failure and want to share their experience. You might have an LVAD, you may have had a heart transplant, or if you've experienced similar symptoms, feel free to call us at 877-NYU-DOCS. That's 877-698-3627. Or you can email us at docs@SiriusXM.com. Buba Dimi is a heart failure patient. He actually has a left ventricular assist device that helps the pumping action of his heart as he waits for a heart transplant. We're talking about how he found out he was diagnosed with heart failure. And since you have the LVAD, Buba, do you have any heart symptoms?
No. I've been very fortunate. I haven't had really any symptoms heart related. I've been fairly stable. Luckily, it's not the case for everybody. So I'm very appreciative of that. So we support each other, and but like I said, my challenge has been mostly mental.
Right. And how often do you see the cardiologist?
In my case, I usually see them once a month.
Right.
And then obviously, if there's anything urgent, we can always call them. I've been really, lucky with the team. They're available via phone, via email, and some of my doctors even taking me to, are available for coffee. They help me with career advice, and they really don't. And that was the thing about this journey. It's different from it's a problem that has no solution at the moment, and it's something that's going to live with forever. So it's a different approach, and then so you need to be very holistic, and every case is unique. And I feel
that's
like
right. Every case, especially for the underlying condition that you have, the left ventricular non-compaction, there are people that have it at different severity. Mm-hmm. And they have to be constantly monitored.
Yeah.
And you know who's joining us? Your doctor, Dr. Michael Gewirtz. Welcome, Dr. Gewirtz.
Thanks very much for having me. Hi, Buba.
Hi, Doctor.
And Dr. Michael Gevirtz is medical director of the Heart Transplant and Mechanical Circulatory Program at the Brigham and Women's Hospital and professor of medicine at the Harvard Medical School. So, Michael, I'd like you to heart failure is very scary, to throw that out as a diagnosis to anyone, especially someone as young as Buba was at the time. So can you just explain to our listeners about what is heart failure? What do we mean?
Great question and good point to start with. We, in the heart failure community, the medical community, we've been trying for years to come up with a better description because for many patients the heart is not failing and they're actually doing well, and it's a chronic disease that they can live with for many years on medications, following up closely with their doctors and nurses and other support team. Simply, heart failure is a condition in which patients develop symptoms such as fatigue, shortness of breath with activities, and may retain fluid, either swelling in their legs or swelling in their belly. And it's associated with a number of typical heart conditions, including heart attacks, high blood pressure, as well as infections and other inherited cardiac problems.
Yeah, and is it common for people to be diagnosed so young with a heart failure condition?
It's uncommon. Heart failure, like other chronic diseases, tends to be more common in older patients. And as one gets older, the risk of developing heart failure is higher. But we certainly see patients who develop heart failure at younger ages, like Buba. We see increasing numbers of patients, for example, who were born with heart conditions and have received such tremendous care through their pediatric providers now are living later into adulthood and developing heart failure.
So, I think this is really, we talked about a few things before you came on with Buba, and he had a condition known as left ventricular non-compaction. And I want you to try to explain that to our listeners, but also that, sometimes a viral infection, you don't have to be born with the condition. Sometimes people develop the condition as a result of other things.
Correct. So the vast majority of the patients that we see in our heart failure program and are seen really around the country and internationally are patients who have developed heart failure later in life, as I said, from other routine heart conditions. The condition that Buba has is uncommon. Non-compaction cardiomyopathy in many cases is an inherited form of heart muscle disease, although for some patients there is not a suggestive family history. It falls into the category of cardiomyopathies that we call non-ischemic, meaning they're not associated with heart failure or blockages in the coronary arteries, and it's really a primary heart muscle disease where the heart enlarges and weakens over time.
Right, and one of the important things is recognizing the symptoms of heart failure, because a recent study showed only 1 in 5 people recognize the symptoms.
Exactly. As I mentioned, some of the symptoms are fairly nonspecific: fatigue, shortness of breath with activities. You could think of a number of causes for those symptoms, from other heart conditions to lung conditions to conditions involving, say, the thyroid gland. There could be non-medical issues, anxiety, depression, and stress that can cause similar symptoms. So often these patients can go undiagnosed for some time before ultimately they learn about their condition.
So another thing we spoke about with Buba is his left ventricular assist device, and I thought you would go into some more detail for our listeners about what this device is and how you make the decision to recommend one.
So we take care of many patients with heart failure. The vast majority of patients, as I said, do well for many, many years and don't require these types of what we call advanced therapies, whether it's a heart assist device or heart transplant. But for a small percentage of patients who unfortunately develop more severe or advanced heart failure and no longer are responding to standard medical or device therapies, we need to consider other options. The left ventricular assist device that Buba has been around in some fashion now for more than 25 years. Currently, it's really used for two main purposes. One is for patients like Buba who are on the waiting list for a heart transplant,
Sure.
and the pump can be implanted as what we call a bridge to transplant. It's allowing him to essentially function at a normal level while he's waiting for a donor heart to become available. The other main population of patients are patients who are not eligible for a heart transplant, most typically because of age or maybe other medical conditions, who would have a pump implanted for what we call destination therapy or lifelong therapy. There's a very small number of patients who have a device implanted for what is called bridge to recovery, where during the time that they're on the LVAD support, their heart actually recovers and the device is removed.
And then they just probably stay on medicine.
Exactly.
And, what do you think, a lot of times, as you mentioned, the symptoms are so non-specific. When would someone know they should see a cardiologist and not their primary care doctor?
Well, certainly new symptoms that patients have not had before, particularly problems with their breathing, especially if they start to notice that the difficulty breathing is coming on with less activity, or if they start to notice problems with breathing at night when they're lying down in bed. Also, if they start to retain fluid, it's not normal to have swelling in the legs or swelling in the abdomen. Those would also be, concerns that certainly one should bring to the attention of their primary care practitioner.
Buba, I believe you mentioned earlier that you were not able to be, as you started noticing that you weren't able to be as active, right?
Yes.
You want to go over that again?
Yeah, so I think what was the odd sign for me was that it was around the time I was actually I was kind of the leader of the boot camp, so I was running the boot camp, and one day out of nowhere we're like, okay, let's go for a run, and I just couldn't run anymore or keep up. So then I was like, oh well, I know I haven't been always I haven't been as fit, but 2 weeks is a short time. So something told me not to force it, but then I noticed the chest pain, and it just never went away. So in my case, that was the main thing, and slowly I would start to while I'll be speaking, I'll just go into a difficult cough, and that was my case. What made it hard is I always look I guess in shape and fit, so it makes it hard. It made it hard for. That caused a few mixed diagnoses where they assume it was I was being lazy, or maybe I had GI issues or maybe some flu. But in my case, that was the main thing. It was just like a dry cough that never went away, and sometimes that cough was wet. But that was my the odd side.
Buba, you make a great point.
Yes,
because Buba makes a great point, and really it was the change from his baseline. It was change from his normal.
Absolutely, yes.
And even in older patients, where I said heart failure is increasingly common, patients who say, well, I used to play 2 sets of tennis, and now I really can only get through 1 set of tennis, or I used to golf 18 holes and now I'm golfing 9 holes. Or I used to walk with my grandson around the pond, and now I can only go halfway around the pond. So and they initially will attribute that to just being out of shape or getting older, but those are not necessarily the right explanations.
Yeah, and I want to, Michael, there's an email from Dina from Iowa.
Mm-hmm.
She writes her husband is a bit overweight and doesn't have the best lifestyle, was just diagnosed with heart failure. Can a change of lifestyle correct this?
Wonderful email.
Yes.
And the answer is definitely.
Okay.
There is a type of heart failure, and again, not knowing the specifics of this
Sure.
patient, but in general, there are about half the patients who have heart failure actually have normal heart function. It's called heart failure with preserved ejection fraction, or normal heart function. And often this can be seen in patients with other what we call comorbid conditions: obesity, sleep apnea, high blood pressure, diabetes, kidney problems. And if one corrects some of these other contributors, the heart failure condition can improve significantly, and in some cases can go away completely.
Yeah, I think we can always find a role for lifestyle changes to improve many aspects of heart health. I'm also going to open up the phones for our listeners who want to ask their questions about heart failure or share their experience being treated with heart failure at 877-NYU-DOCS. That's 877-698-3627. Or you can email us at SiriusXM.com. I'm on the phone with Dr. Michael Gewirtz. He's medical director of the Heart Transplant and Mechanical Support Program at the Brigham and Women's Hospital and professor of medicine at Harvard Medical School. And Buba Dimi, he's a heart failure patient. He's a patient of Dr. Gewirtz. And Buba, I want to ask you, have you made any lifestyle changes?
Well, in my case, I think I was already active. I was already...
Sounds like it.
I never smoked. I never drank. So I was kind of, I would say, clean. So what I did is just continue on those good habits and try to be consistent with it. So I totally removed salt. I don't eat. I don't add any salt or sugar to my diet, and so I try to be as efficient as possible. And then that allows me to have. I think when you are really sick, it makes the margins are very small, so you're very sensitive to this element. But it allowed me to build enough margin so where I can have pizza day with my family and not feel any side effects and things like that. But I think developing those habits, motivating myself, which is hard, but making it a habit helps a lot. And then putting myself in a support system so my family keeps me in check, and also I keep challenging myself a bit more and a bit more. Up to the point that recently I was actually about to go back to play soccer, and but I twisted my ankle, and then Dr. Gewirtz saw me the day after, so that was a fun story. But I try not to push the limit so much. Yeah,
Michael, it's really important to be able to get our patients to be active, but also make sure the activity is within a certain range, right?
Yes, that's definitely right. And we often look to some of our colleagues, some of our cardiac rehabilitation specialists to help provide the appropriate exercise and activity recommendations for our patients.
So if I may add, I think one critical part, I think I'm glad Doctor mentioned cardiac rehabilitation. During my recovery, I think after my chest was healed, that was about 3 months after the operation. I was put on a cardiac rehabilitation program for another 3 months, and I think I continued for about 6 months. And that was really pivotal and critical because the big part of it is doing the right thing and being observed, and also confidence, and then the metrics. I remember out of the surgery, I could. The goal was for me to do 4,000 steps a day. I couldn't get to 2,000, but 2 months into the program, I was pushing 8,000, and then maybe 6 months or so after I was able to be consistently on 10,000.
That's
and
great.
I remember the first hard work we did which the doctor and the whole
Sure.
team came to support us. I walked 24,000 steps that day.
That's amazing.
So the cardiac rehabilitation and all the support, I guess, around was very helpful.
That's great. We have Edward from New York who has a question. Edward?
My question is hypertrophic cardiomyopathy, the progression to congestive heart failure, whether it's diagnosed and treated as mine was, or undiagnosed leading to congestive heart failure as any other outlet obstruction would also lead to. In my case, I was misdiagnosed with coronary artery disease by 3 cardiologists until finally somebody said, you might have coronary artery disease, but you definitely have an outlet obstruction, which is likely to be hypertrophic cardiomyopathy.
Yeah, I want Dr. Gewirtz to answer that question. Michael?
Yeah, that's a very a fairly specific question, and the gentleman mentions a type of cardiomyopathy that is uncommon. It's not rare. It's typically another form of familial or inherited heart disease, although if one has a small family or is adopted, one might not have that family history. But that's a type of cardiomyopathy that can typically be diagnosed by an echocardiogram and other standard cardiac testing or a cardiac MRI, and definitely with a diagnosis such as that, I generally would recommend that patients be seen by a specialist, either in heart failure or cardiomyopathy management, because the treatment of these patients is quite complicated and does require expertise.
Okay, thank you, Edward, and I want to thank you.
Where can one find a cardiomyopathy specialist or a heart failure specialist? Remember, I had 3 misdiagnoses, all for coronary artery disease, and I was about to have stents when I met the right guy.
Edward, most academic medical centers, where there's medical schools, have hypertrophic cardiomyopathy centers. We actually have one here at NYU. I want to thank you for calling in. I want to thank you, Dr. Gewirtz, for joining us today. And Buba, most of all, thank you so much for sharing your story.
Thank you very much. I really appreciate it. Good to hear you, Dr. Gewirtz. Say hi to everyone.
Thank you.
Thanks for having us.
And you're welcome. And later on, Beyond the Heart, avoiding ear infections in the colder weather. But first, learn better ways to describe your pain, which can increase your odds of finding relief. Stay with us here on Dr. Radio, Sirius XM 110.